The most relevant, I think, clinically is the impact of Aflibrecept and more broadly the effect of anti-VEGF agents in the setting of diabetic retinopathy. So diabetes is a big deal across this country and around the world, and diabetic retinopathy is one of, if not the earliest manifestation of diabetes inside of the human body. Vision's important, and the way the diabetes affects the inside of the eye is that it's a progressive retinal vascular disease. So it leads to slow, progressive, and until now we really thought irreversible loss of vascular function. But it turns out that with good treatment with anti-VEGF agents inside of the eye that we can dramatically slow and possibly even reverse some of that vascular damage. So the study that we are looking at in particular is called the VISTA and VIVID trial program. They are the large phase 3 international trials that led to FDA approval of Aflibrecept for the management of DME and the management of diabetic retinopathy in the setting of DME. And when you look at these trials, one of the values is that we have fluorescein angiograms, which is a very specific way of imaging the back of the eye, looking at the retinal vasculature. Right? We already said that that's the core place that diabetes damages. And so these angiograms allow us to look at the vessels at a very close and detailed level. And when you look at these angiograms longitudinally, it turns out that in this trial, VISTA in particular, one of the two trials we've analyzed so far, when you inject Aflibrecept repeatedly in the eyes, and the core treatment being to treat DME, one of the side benefits that we think is actually really important now is the impact of Aflibrecept on the retinal vasculature. So it appears to stabilize the retinal vasculature and actually lead to improvements in the perfusion status in a majority of eyes, which was not expected and is an important finding. If you take a diabetic population of patients, right, they get many impacts across their body. Heart disease, brain disease, peripheral vascular disease, all sorts of issues. The eyes are unique in that they are a very active vascular bed. So on average, the eyes are the earliest and the most common place impacted by diabetic retinopathy. And within that, diabetic macular edema is by far the most common cause of vision loss and blindness in this population. And because diabetes is so common, actually DME, or diabetic macular edema, causes more blindness than everything else between the ages of about 20 and 65 in our country. So it's a really big player. It's a very large number of patients across the country. And these treatments that we use, these anti-VEGF agents, have only been around for about a decade. And Aflibrecept has only been approved for a few years. And these work really well to treat DME, but as we dig deeper into the data, it turns out that they have a much, probably more important impact on the disease itself beyond just improving DME itself. Yes, absolutely. A really important concept here is that all diabetics need at least annual ophthalmic screenings. It's really important that anybody with diabetes, whether they think it's well controlled or poorly controlled, it doesn't matter. If you have a diagnosis of diabetes, you really should be seen at least annually to have a good eye exam. Because many of the manifestations of diabetes in the back of the eye can initially be asymptomatic. But they can be very clear on an exam if you have a good dilated exam. And once those are identified, it's clear that for most retinal diseases, the earlier you treat them, the better patients do.